A Doc SIBO and Max Studio Productions presentation. How SIBO can lead to anxiety and depression. Did you know that our bodies are home to a large number of bacteria, and most of them reside in our gut? The health of our gut is crucial for maintaining our overall physical and mental well-being, and it heavily relies on this bacterial ecosystem. Research shows that the gut microbiome, consisting of diverse bacteria, can significantly influence our gut and our minds. SIBO, Small Intestinal Bacterial Overgrowth, is a condition where bacteria grow excessively in the small intestine, disrupting the balance of beneficial and harmful bacteria. This imbalance can affect brain chemistry, and almost always results in behavioral changes, such as increased anxiety or depression. SIBO and other factors that disrupt the gut microbiome can make individuals more susceptible to infections, triggering molecular reactions that provide feedback to the central nervous system, CNS. The gut and CNS are connected through a communication pathway called the gut-brain axis. Did you know the gut and brain are connected through a communication pathway known as the gut-brain axis? This two-way axis allows for continuous interaction between the gut and brain. The key components of this axis include the vagus nerve, which carries signals between the gut and brain, allowing communication related to digestion and gut sensations. The gut microbiota, which refers to the collection of microorganisms in the gut, also play an important role by producing substances that can travel through the bloodstream or activate nerves, influencing brain function, mood, behavior, and stress responses. Imbalances in the gut microbiota or disruptions in the gut-brain axis have been linked to mental health conditions such as anxiety, depression, and other psychological and psychiatric behaviors. Recent research shows that gut microbiota can impact neurotransmitter production, neuroinflammation, and even the development of the central nervous system. Changes in gut bacteria can initiate chemical reactions in the body, releasing neurotransmitters, cytokines, and hormones that affect brain function and activity. Imbalances in neurotransmitters, such as serotonin, dopamine, and GABA, have proven to be linked to anxiety and depression. These signaling molecules can travel through the bloodstream or nerve pathways connecting the gut and CNS, influencing mood regulation, stress response, cognition, and behavior. The gut microbiota also plays a significant role in long-term health, particularly during early life. Antibiotic use, lack of breastfeeding, cesarean section birth, infections, stress, and environmental factors can alter the early microbial composition of the gut. These changes may impact our response to stress and influence long-term physiological and behavioral outcomes. Researchers have associated gut microbiota with stress-related conditions such as anxiety, depression, and irritable bowel syndrome, IBS. Maintaining a healthy gut microbiota through diet and early life interventions can profoundly affect physical and mental well-being. The crucial role of the gut microbiome, including the implications of SIBO, emphasizes the importance of maintaining a healthy bacterial balance for overall well-being. The choices we make in our diet have a profound impact on the connection between the gut, the brain, and our overall health. One example is the role of beneficial gut bacteria, known as probiotics, which have demonstrated the ability to reduce symptoms of stress and anxiety. John Cryan, a pharmacologist with the Alimentary Pharmabiotics Centre at University College Cork in Ireland, and colleagues, have found that probiotics directly impact mood neurotransmitters in mice. Their findings supported the idea that one way to heal mental problems may be through the gut. At least in some cases, bacteria communicate with the brain via the vagus nerve. When the vagus nerve is severed, the effects of gut bacteria on brain chemistry, stress response, and behavior come to a halt. Those findings shed light on how bacteria may influence the brain, and also fit with other work in humans, suggesting that vagal stimulation can be used as a last resort for treating depression. A neurochemical delivery system exists by which gut bacteria, such as probiotics, can send messages to the brain. Gut bacteria produce and respond to the same neurochemicals, such as GABA, serotonin, norepinephrine, dopamine, acetylcholine and melatonin, that the brain uses to regulate mood and cognition. Such neurochemicals allow the brain to tune its behavior to the feedback it receives from the army of bacteria in the gut. And why not? After all, considering the abundance of bacteria in the human gut, wouldn't it make sense that your brain would want to keep tabs on it? Scientists are uncovering how the gut microbiota communicates with the brain through various pathways, such as the vagus nerve, gut hormone signals, the immune system, and bacterial metabolites like tryptophan and short-chain fatty acids. SIBO can contribute to anxiety and depression through several mechanisms, including 1. Inflammation. SIBO can trigger chronic inflammation in the small intestine. Inflammatory molecules can enter the bloodstream and reach the brain, affecting the balance of neurotransmitters, which are chemical messengers that regulate mood. Imbalances in neurotransmitters, such as serotonin, dopamine, and gamma-aminobutyric acid, GABA, are heavily linked to anxiety and depression. 2. Gut-brain axis. The gut and the brain communicate bidirectionally through the gut-brain axis. Disruptions in the gut microbiome, as seen in SIBO, can impact this communication, leading to changes in brain function, and potentially affecting mood regulation. The altered gut microbial composition may influence neurotransmitter production and signaling. 3. Nutrient deficiencies. SIBO can interfere with the absorption of nutrients, including vitamins and minerals that play a crucial role in brain health. Deficiencies in nutrients such as vitamin B12, folate, and iron have been associated with mood disorders like depression. 4. Increased intestinal permeability. SIBO may disrupt the integrity of the gut lining, leading to increased intestinal permeability, often called leaky gut. This leaky gut can allow toxins, bacterial byproducts, and inflammatory molecules to enter the bloodstream and potentially affect the central nervous system, contributing to anxiety and depression. 5. Dysbiosis. SIBO involves an overgrowth of bacteria in the small intestine, often with an imbalance between beneficial and harmful bacteria. This dysbiosis can lead to alterations in microbial metabolites, and the production of substances that may impact brain function and mood regulation. It's important to understand that not everyone with SIBO will experience anxiety or depression. Lifestyle, genetics, and other medical conditions can also contribute to the development of these mood disorders. However, many individuals will experience the connection between SIBO and anxiety or depression. To effectively address the connection between SIBO and anxiety and depression, it is crucial to undergo testing for SIBO to determine the severity of the condition. This information can guide treatment protocols and help tailor a comprehensive approach. The holistic management strategy should encompass factors like targeting gut dysbiosis, reducing inflammation, optimizing nutrient levels, and implementing interventions such as antimicrobial therapy, dietary adjustments, and lifestyle modifications. By integrating testing for SIBO to assess severity, healthcare professionals can develop a more personalized and effective treatment plan. It's highly recommended to seek guidance from a healthcare professional with experience working with SIBO patients. They can provide personalized advice tailored to your circumstances, helping you navigate the diagnosis, treatment, and comprehensive management of SIBO and anxiety or depression. Thanks for watching.